Tiwari is someone we constantly speak with. He's, our go-to a lot of times when, we're wondering about how to sort of deal with the situation and so on. Um, I'm so excited that we're having a conversation on homeopathy, I was reading a paper just the other day where in the UK, they've done one evidence-based study or something like that, and the conclusion they've come to is that homeopathy does not work. It is merely placebo, right? So I think part of the agenda here is to really open up these conversations and truths that are sent to us from different parts of the world. So, Dr. Tiwari, that really is what I'd like to start with. Does homeopathy work, or are these just, sweet sugar pills that you take and then the placebo effect takes over? Which, by the way, I think is pretty incredible. If you can just take some sweet pills and the placebo effect can take over and it keeps you from allopathy and so on. I mean, that's quite incredible. But is homeopathy just placebo? Let us begin with the big elephant in the room, as they say.
No, so thank you for having me here. I think I enjoy this much more than I think what I contribute to the stage here. Like you said, I think if homeopathy was just placebo and it was still doing what it does, it was still giving results. I don't know why anybody should have a problem with it, because we have cures, we have people getting better. So I think while you're talking about this study that said homeopathy doesn't work, I think there is a place somewhere in Switzerland, a small town where almost 90 to 95% of people are on homeopathy, and they said that we will not give this up, even if you are proving that technically or whatever scientific term they come under, that we will not give up this. This has worked for us, and that is something I think is the basis on which we continue to go on. I myself I come from a homeopathic family. My father was a homeopath. So it has worked for us. It has worked for us in very severe cases like pneumonia also. Uh, we see it working day in and day out, and that's why so many people come to us. So I think the methodology of these scientific studies, which are much more uh, material based, will not be able to justify what these effects are. Though there are certain studies that are on, I think there are certain homeopathic doctors who are working at the Tata Institute of Fundamental Research, trying to understand the molecular behavior of these homeopathic medicines, because medicines are so diluted that you can't identify the material in it. And that's probably the biggest controversy that it creates. So I think there are people who are working on those lines, and I mean, as we get some results, they will also be published. But mostly it works from a subjective perspective. People who have experienced it, people who have experienced acute illnesses getting better in a day, few hours, people who've seen illnesses like dengue settle in a day, platelets coming back probably second, third day. Those are the people who vouch for it. And we've seen certain people, let's say one of this girl I was treating, I was called upon to treat. Uh, Bhargavi from Bapu Trust was involved, who had come with an acute psychotic breakdown. First episode around 12 years old. Uh, Bhargavi was doing some ABT with her, and they thought that she needs medication. But at such an age, definitely not to go for allopathy, so they called upon me, what can I do? I sat down with the mother, I sat down with Bhargavi. We had a lot of detailed discussion about what her condition was. And after prescribing homeopathy, within 2 weeks, she had settled down, she had gone back to school, she had started expressing her well. So those are the experiences which tell us that, this definitely works, and it is not placebo. Because we have also seen that sometimes when we do give placebos, they don't work. So I think the methodology of research which will prove has to have a lot of qualitative base in it, has to have a lot of subjective experience incorporated in the understanding of what works, and not just go by parameters which are quantitative only. Sorry.
I mean, I have to make a little disclaimer here. So, my daughter is now 8.5. She has not till date taken any antibiotic. She's a homeopathy baby, and she's very proud of it. She keeps saying, "Oh, I'm a homeopathy child." So much so that I mean, just 2 months ago, she was very severely ill, and when we went to her pediatrician, we didn't quite know what it was. It seemed like viral and so on. And then the doctor was like, what, let's just try one, antibiotic. So we're like, okay, I mean, because it's not ideology for us, it's not any kind of dogma. We said, yeah, sure, let's just do. So we gave her the first dose, and then the pediatrician called us, and she was like, you know what, so many years you've been without giving her antibiotic. You've given her one dose. We said, but we gave her the dose you told us to give it, so we've given it. She's like, you know what, theek hai, jo ho gaya, don't give it to her anymore. Let's see how it goes. Let's see if she, gets better on her own, right? That's the pediatrician telling us,
Yes,
right?
yes. No,
Because she was amazed as well,
so
you know.
in fact, we have certain pediatricians who have their children being treated by homeopathy. We have a lot of allopathic doctors whose children, whose family are taking homeopathy for their own selves.
Right.
And they believe in it, and they also support us in, many times when we need some allopathic support in certain conditions, and they are there as a backup. So there is a very good relationship that can get, I mean, that is established to in a certain small way, but that is possible if we are able to communicate more, if we are able to be open to each other's ideas more. So.
So, yeah, and she recovered without the antibiotic, regime being completed. Um, Dr. Tiwari, I'd like to understand from you, there is definitely emotional distress that happens, right? And that is very real. And the experience of that is also very real, right? And it reduces us to states of despair, and often states of despair that seem very unfamiliar to us. That is really when you begin to feel scared of yourself and what you're experiencing, right? And that's when you feel that, oh, I need help. This is not me anymore. Something is happening to me and I don't quite know what that is. That is really where that call for help comes from, right? When you really feel completely, sort of vanquished by everything that has happened around you. You've been conquered in a way, by the circumstances around you, and you feel there's something wrong, right? Now, when somebody in that state of mind comes to you, what is the philosophy that homeopathy will use to understand the person? Because in psychiatry, you say that, oh, there is something wrong with the person, some chemical locha, although there is no proof for that. I mean, it has been proved time and again. Many scientific studies have happened which have shown that there is no proof that there is any kind of chemical imbalance. But yet, whatever, it will say that, okay, there is something wrong, something's happening that you can't quite understand, right? So that also sort of exoticizes it in a way. But how does homeopathy look? What is the philosophy behind homeopathy?
So I think one of the most important things is the understanding of individualism, that it is the person that we are looking at who is suffering and what is the suffering of the person. Uh, the understanding of why the suffering has happened comes from a certain concept of health, where health is understood as a harmonious adaptation between the person and the environment. When this harmony gets disturbed, or like the understanding of life force all of us have, something that makes us different from the dead, uh, taking cognizance of that life force, considering that yes, this is something which is at play and which is responsible for a certain kind of harmony within the system and a certain kind of harmony which happens from with the external. When this harmony is disturbed for whatever reason, I mean, we can talk about the causations a little later, but when this harmony is disturbed, this adaptation is disturbed, that's when a certain disturbance internally is experienced. As that is experienced, it is expressed out in terms of signs and symptoms. When we are able to understand these signs and symptoms, if we take, say, for example, somebody breaks down into a depression episode, there will be certain signs and symptoms which will be common to many people, that okay, this is what we call depression: low mood, no enthusiasm, no motivation for doing anything, negative thinking. These are the common things, and that is how we diagnose it to be a depression condition. but there will also be certain very unique individual subjective experiences or certain behavioral expressions which will be very unique to that person. And that is where we understand that this person is reacting as a total unit, which is different from another person. So the depression in two different people are entirely different stories, are entirely different phenomena. And from a homeopathic perspective, we try to understand this phenomena. We try to understand what is wrong with this person, what was the normal of this person before they broke down into this episode, and how are they responding now. What is the expression that, so what is the deviation from health is what we consider as a disease entity. We consider health as a harmonious functioning. So with this philosophy, we try to understand who is this individual, what is the individual story, and when in distress, how is this person expressing out in terms of the mental expressions, behavioral expressions, and physical, physiological or pathological expressions. Uh, which also talks about another very important understanding of the concept of holism. How an individual gets affected as a whole, not just a part. The mind is not the only thing which is disturbed, it is the entire system. If say there is a physical illness, then it's not just one organ which is affected, it is the entire person that is affected, because it does affect a lot of other functioning, which if we focus and we observe very keenly, we are able to find out this individuality, that okay, the suffering of this individual is different than the suffering of that individual. And that uniqueness is what forms the basis of whatever prescription or therapy that we direct towards the person.
But at the same time, we're not just saying that it is a medical problem, right? We are also, I mean, in your own work as well, I mean, the fact that you've integrated arts-based therapies, right? The fact that you talk a lot about the importance of perspective changing, all of these are also elements, right? So if you could describe these as well, so it's not just as simple as, oh, okay, this, and just take this medicine and, that's it, right?
No, 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 it's not at all simple. I mean, I'm finding it very difficult to put it simplistically because there are so many complex concepts. I think it's not, the person is not very difficult. I think our theoretical framework is more complicated than that. But to put it simply, I think if we understand that when a person goes and, when we experience through life, there are certain issues, certain situations that we are able to adapt well to, and we move on, even though they are difficult, even though we may find difficulties, we are able to move over them. But sometimes when something hits us, maybe at a sore spot, say if I am predisposed to a certain kind of disturbance, even a small stimuli will affect me profoundly. Or if I'm otherwise okay, but the stimuli that's happening in front of me is very big and it really impacts me, then I will respond to it in a manner like how we talk about coping mechanisms. So what kind of coping mechanism I use, as long as my coping mechanism is matured, healthy, I will be able to adapt to the situation and move on, and that's what we call health. But when we are not able to have, say, matured coping mechanisms or more, positive defense mechanisms, then we break down into, or we get into a disturbed state of functioning, and that disturbed state of functioning then again shows through signs and symptoms. So understanding this disturbance, that and peculiarly for this person, even if we are looking at, say, two brothers or siblings from the same family, their experience of the same thing will be different because essentially they are two different people. So even from the same event, how people get affected differently, that individualizes them, and that individualizing is the basis of treatment. How do we correct this problem? Now, medicine, homeopathic medicine is one of the methods or one of the tools by which this balancing of the adaptive processes is happening. But there is a lot of interaction that happens between the doctor and the patient, which is where, like, the first interaction itself is a very lengthy interview that we get into. And even say somebody's come for a headache, we ask them all the history about themselves, their emotional beings, we go into family history, we get into family setup, we get into how this person has evolved to this point of time. And basis of that evolution of the person, how is this symptom an expression of the person's internal disturbance? So the diagnosis of a migraine may not be the decisive factor for a prescription, but the conflict that the person is coming from, which is expressed externally as a headache or a migraine, that conflict becomes the basis of the say remedy selection, or if we need to say sort out any particular issues which are interpersonal, or the person has a certain way of perceiving things. If there is some problem at that, then those perceptive differences or perspective mechanisms are helped to change. So a lot of talk therapy, a lot of non-medicinal approaches also become a part of this. Like I think we had the earlier session where the grandmother's wisdom. So a lot of common sense, a lot of the way we have lived our lives and we've seen how things work. How can we simplify it? How can we give the person better coping mechanisms or better adaptive strategies to go by? This also forms a part of the therapy, and this is in fact, if I go back to the homeopathic literature, these are the things that are advised as the first interventions. Like you correct the diet and regimen of the person, correct the daily routine that a person is going through. A lot of problems get sorted with that only. Still, if things are not getting better, then maybe you need to look at a homeopathic remedy which will help you go further. Because if these basic things are not corrected, then even a remedy is not going to give you some kind of a miracle. So it's a very, by default, it's a very integrated, holistic approach. Of course, not a lot of homeopaths may have expertise to these specific therapies, but a certain framework of approaching holistically, approaching that, okay, if there are other issues to be sorted, so we do call upon family members to discuss that, this person is having a difficulty with these issues. How, if they are a contributory factor, then that needs to be sorted. So in that sense, I think without the label of therapy, homeopaths have been doing therapy for a long time, even for cases which are physical in nature or physical pathologies, because at the background of this is a lot of psychological conflict. So a whole lot of psychosomatic medicine is what homeopathy basically caters to.
Right. You're speaking about diet, and a lot of times, at least I certainly was as a young person, I was very dismissive anytime anybody would talk about diets, and I'd be like, oh God, here's someone giving me some bhashan again on diet and what you should eat and what you shouldn't. But I just want to bring, it's something that I had spoken about when we were talking, Dr. Tiwari, some very interesting research that has come out from the Harvard Medical School, where they're looking at diet, just diet, and a ketogenic diet in particular, and how that completely changes the manifestation of symptoms. So there's this incredible story of someone who was given a diagnosis of schizophrenia at age 17. She went through that entire sort of thing till age 70, where she went in for multiple hospitalizations, multiple attempts at, taking her own life. The usual, what happens with, when you're doing it the usual way, right? And then at age 70, she was extremely overweight and so on. She was just asked whether she wanted to be part of an experiment that was going on, a university experiment on ketogenic diets, right? And it had nothing to do with her schizophrenia. And she just joined up just like that. And within 6 months, all her symptoms were gone. She was off psychiatric medicine. Somebody who'd been on psychiatric medicine since age 17. 17 to 7, that's 50 years. She was off psychiatric medicines in 6 months. And this is a study, that was done, evidence-based. So the whole, and that was done. And she lived till the age of 85, and then she, passed away by natural causes. But she lived without medicines, right, and without her symptoms. She lived as regular a life as anyone else, right? And that was through a ketogenic diet. And it's work done by Dr. Chris Palmer, and he's written a book about it as well. It's called Brain Energy. And what he suggests is that rather than a chemical imbalance, which has been debunked in most of the Western world, it is really something at the metabolic level, and he identifies the mitochondria. And so his entire book sort of talks about that and so on and so forth, right? So diet, I would be very dismissive of diet, so I'm just saying that, I know better now, and I'm not as dismissive any longer of diet. Uh, yeah.
No, but I think what I would like to respond here is that let's not just get stuck to anybody that comes up with that, this and this only is the
Correct.
solution.
Yeah.
I think any solution is a very good solution for a set of people,
Yeah.
but it does not work with another set of people.
Correct.
So having an overview about as many therapeutic approaches or as many options as possible,
Yeah.
and then trying to see which would help in which person,
Yeah.
because there is diversity at the level of people that we cater to. At the same time, there is diversity at the level of the provider or the services that we have to provide or the help that is available. So whenever any theory comes, it seems like, oh, this is the answer to
Yeah.
everything.
Yeah.
I don't think there will be any one answer
One
to
answer.
everything, and I mean I could say that for homeopathy as well.
Yeah.
It is always a combination of certain things that the person requires.
Yeah.
I have seen some people require without medicine in my clinic, where we have, just in the first interaction itself, we've identified certain issues, and there were symptoms that the person came with, and those symptoms disappear. So a lot of times we need to know what are we treating and what is the issue and how much is it getting resolved.
Yeah.
If the issues are getting resolved with whatever approach you give, I think it's good, and a combination of approaches really works well.
Yeah. Yeah. No, I think I completely agree. And in a way, that really is the essence of this festival as well. When we say 360-degree approach, what are we talking? We're really saying that we're all different as human beings. And what works for one person may not work for another. So let us just expand the bouquet of options. Let us at least know what the various options are, so that we can then see, okay, this has worked, not worked, okay, let's try the next thing. Because it is so complex, and that is what I always say. If mental health was so simple, we would have solved it. We wouldn't be talking about it right now. It is because it is so complex that we have to have a festival like this and talk to each other and try and find ways in which we can either heal ourselves or help each other heal.
So I'd like to share here, like I think one of the first experiences I had, this is probably 15 years ago. One of the first clients that walked in, and I was like, okay, so what is the problem? And this guy said that you know I'm gay, and I was like, okay, but what is the problem? And he was taken aback, which at that time it struck me that, okay, so he was thinking being gay was a problem. And I was like, I don't think that is the problem. What are you feeling? Let's talk about, what's affecting you, what are you going through. And then he talked about everything which we would otherwise, categorize as depression. Going beyond those symptoms, what I found was he was in love with this man, and the man was not responding back. And that's where he was in tremendous grief, a lot of disappointment in love, as we say. And that was what he was suffering with. So when I kind of dealt that aspect with homeopathy. Of course, at that time I was not too much into talking. Uh, he did very well, and I mean, then he was able to even embrace his own self. And I mean, today he's working very well. He's completely integrated in his life, leading a happy life. And I mean, we connect as casual contacts. He's not a client anymore, but we do keep in touch and just ask if everything is okay.
Dr. Tiwari, could you talk a little about some of the case studies, some of the people you've treated, and what their trajectory was like, and how it sort of went up, how it sort of unfolded.
I think it's a very mixed bag in that sense, because um, so if what I've tried to do is, there are three categories of people that I identify who come to my clinic. One, who have a lot of misunderstanding, who have a lot of ignorance about how to lead a good life. Very bad schedules, very bad diets, a lot of gadgets, and getting into the phone and TV and all of those. They come with a lot of symptoms. In those kind of people, just resetting a schedule, just getting them to come back to a circadian rhythm which our body is naturally aligned to, that helps a lot. Just structuring that, and a lot of their symptoms go away. A lot of because in those people there are a lot of deficiencies. We see a lot of vitamin D deficiency, B deficiency. Correcting just those things, that eat well, sleep well, simple common sense solutions, they work very well, and they do. And this is a big chunk of people who come to me. Second is where they have moved from this into some kind of a functional disturbance, where even just by sorting these basics out, still the symptoms are going. They're still not able to sleep, still they're not able to feel a certain way that they want. And there, the homeopathic medicine really, really works very well. We do keep talking about a lot of issues that they are going through, emotional conflicts and all that. But definitely there, some homeopathic medicine is required. And when we give that medicine, the pace of improvement really improves. What we have not been able to, say, build in 2 months, within the next week, suddenly something happens, and they're like, what was that medicine? What did you give me? So that's the second set of people. The third set of people are who already come with a diagnosis, who already come with a long list of medications that they are on. Uh, I would say personally for me, those are the more difficult of the kind of people I see. There is a lot of homeopathy that needs to be given, because there are a lot of symptoms, a lot of distressing symptoms, and the capacity of the individual is very low for making even smaller changes. It takes a huge effort. So there, a lot of medical help is required from the homeopathic perspective. And of course, the side effects that the allopathic medications have had, a lot of weight gain, like metabolic issues. So treating those also as we go by, they take much longer. As they are able to feel better, again the next hurdle we face is to reduce the allopathic medication, which medical legally I cannot do, so I do not get into that myself. We have to go back to the psychiatrist who's treating, and the psychiatrist then, when they assess, they are able to reduce. Of course, it also depends on the kind of psychiatrist that individual is. If somebody is more holistic in their mind, they are able to reduce it faster. But if somebody comes from a place of that no, homeopathy is humbug and nothing, and just you have to take this medicine, then it becomes difficult to reduce the medicines how we would like it to. There are patients who have changed psychiatrist just for that reason, that this doctor is not reducing my medication, let me go to another one who can adjust the doses for me, because I will not be adjusting those doses for them. So yeah, I think this is broadly how my clinical work is.
I'm going to throw it open to questions now. So if there are any questions from anyone. Yeah. Could we have a... Oh, okay, so we'll go with her first and then, yeah, yeah.
Hello. Yeah,
Yeah.
great. You had mentioned about the person who had come to you and said that I think I'm gay and that's the problem. And you said that at that point I wasn't much into talk therapy, but I managed the grief with homeopathy. So I wanted to understand a little bit more about like how does some sort of, and if it is possible, can you treat emotional pain using homeopathy?
Yes.
Can you tell me more about that?
Um, See, the way we see emotional pain in the clinic, uh, the approach would be, what is this person bringing on table? If it is just an emotional state, say for example, there is grief and the person is crying and very melancholic in all of those, then, and nothing else, I'm just taking a very hypothetical example, um, then the way in which we will observe these symptoms and come to, so there are remedies which respond or which correspond to these kind of states. I mean, if we get into the technicality of those, it can be, but that's a long discussion. There are remedies which have the capacity to deal with these kind of states. I will have to go a little bit into the complications of how we know about these remedies. So the way how a homeopathic medicine or the effect of homeopathic medicine is known is by doing something called as drug proving, where we have a group of people of mixed age and genders and everything, and a certain homeopathic preparation We don't call it a medicine before it is proved. So a certain homeopathic preparation is administered to these healthy people. The people who are otherwise generally broadly healthy. When this preparation is given to them, they are asked to observe for changes that happen within. So there will be signs and symptoms that will come up. Some people will experience some bodily changes, some body symptoms. Somebody will, get some mental states. I suddenly started crying. I suddenly started, feeling very okay. I got these kind of dreams. And those changes that happen, they are noted down. So uh, again, when the study is done, it's a double-blind study. So a lot of people are also given placebo to see whether similar symptoms are coming up, and only the symptoms from the people who were given the medicinal the preparation, those symptoms are taken. The placebo ones are not taken. The placebo symptoms also, if they are coming in the people who were given the remedy, those symptoms are removed. That no, these are placebo symptoms, or people are just coming up because of, say, like how you have group empathy. Somebody was feeling like this, so I also felt like that, and I also felt like that. These kind of things, they are removed from the compilation, and a set of symptoms which the medicinal substance is able to produce, that is noted. Now, based on the law of similars, like how we say similia similibus current, like cures like, when we get a person who is in a similar state, this remedy that we have proven earlier, this remedy is capable of uh, reducing or curing that state. From that principle, these things are taken care of. So I hope I'm answering your
Yeah,
question.
it did answer my
Yeah.
question. Yes. Thank you.
So we are a homeopathic family. All of us believe in homeopathy. And though I am a counselor, but my homeopath is my therapist. I want to ask you one thing, sir. How much does faith, when I mean faith in the system, in the medicine, have an impact on my well-being after I take the medicine?
So I think faith is a very general thing for any kind of therapy.
Okay.
It is not specific that you have to have faith in homeopathy for it to work for you. It doesn't have to be like that. Uh, if you are, if you have faith in any kind of treatment, in any line of treatment, then it will work for you because you are more aligned to it. You are more cooperative with it. You yourself want to get better.
No, but I've seen in my family there are people who don't believe in homeopathy, but because we believe in it, तो वो लेते हैं और उनको काम नहीं करती वो.
क्योंकि the way in which they will interact with the doctor, the kind of symptoms that
Okay.
need to be shared, like उन्होंने हमको भेजा था तो हम आके आपके पास में बोल रहे हैं, आप इतने सवाल क्यों पूछ रहे हो? बिकॉज कोई हमारे पास हेडेक के लिए आएगा तो हम वी विल आस्क देम दैट वो दबाने से अच्छा लगता है कि दबाने से ज़्यादा हो जाता है, मूवमेंट करने से अच्छा लगता है कि मूवमेंट से कम हो जाता है. सो वी विल बी गोइंग रियली माइक्रो इनटू कि ये सर दर्द होता है, उसके साथ में आपकी प्यास कैसी होती है, पानी पीने का मन करता है नहीं करता है, साथ में ठंड लगती है कि नहीं लगती है, कोई बात करेगा तो अच्छा लगता है कि नहीं, चिड़चिड़ाहट होती है कि रोना आता है. So we will be asking too many questions, and people who are not really inclined and who have just come because आपने भेजा है, they may not be able to describe things in so detail. Whereas a person who has been on homeopathy for a while, or families like you, we have people giving us a call कि मुझे ऐसा ऐसा हुआ है और इसके साथ में मुझे ये हो रहा है और ऐसा होता है और मेरी प्यास ऐसी है और मुझे गले में ये ऐसा हो रहा है, and they give us everything, we don't even have to ask, and we tell them the remedy and the remedy works. So how, what is the involvement of the person? Like there, I do get people who say, see, I'm skeptical, I don't know about homeopathy and I don't even know if it works, but I'm okay to give it a try. And it's this kind of a try, which is देखेंगे होता है तो ठीक है नहीं तो नहीं. But they are involved in the process. They will give you all the answers that you want. So their cooperation gives us more data, and with that data we are able to prescribe better.
Thank you.
Um, I often get clients who are very skeptical about taking allopathy, especially when they've been diagnosed. And they are quite inclined to taking homeopathy, and that's what they bank on for a number of years. But they still have a lot of emotional problems that they bring up in therapy. So my question is that can someone be on homeopathy completely? Because you mentioned about a collaborative approach and integrating different disciplines and, understanding the entire picture, and completely not look at taking psychiatric help or not having allopathy in the picture.
No, so I think these are two different things. Uh, my father was a homeopath, not a psychiatrist, but the people that have come to me from him, I mean, he's no more now. So they tell me कि हम आपके फादर से ट्रीटमेंट लेते थे ना, तो खाली उनकी बात सुन के ही हम ठीक हो जाते थे. हम लोग ये तकलीफ लेके आते थे, मुझे ऐसा था वैसा था, पर उनसे बात किया ना, बात करके ही अच्छा लगता था. And he was not a certified counselor, he was not a certified psychiatrist. And I mean, I used to feel as a student under him, I'm like, ये क्या बात कर रहे हैं, दवा दो ना, क्या बात कर रहे हो, दवा दो ना. And later we would realize कि ये जो बात कर रहे हैं, जो बिल्कुल casual conversation, it is also no therapy or no, these sections that we've made that, okay, I am a homeopath, I will only give medicine, I am a counselor, I will only do. I think as a healer, if we go rise above these definitions and consider ourselves as, let me help in however way I can help. There have been patients who have given me a call saying, I am terrified, there is a spider on my wall and I don't know what to do, I am paralyzed and full blown panic attack, I don't know what to do. I have had to just simply guide the person that, okay, what is there next to you? I don't know nothing. चप्पल पहना है? हाँ चप्पल पहना है. निकालो, उसको दीवार पे मारो. मर गया? हाँ. How do you feel now? Okay. Now this is common sense. For this you don't need to be therapist, you just have to have your presence of mind. And you need to see what are simple problems that can be solved simply. I cannot get into, but spider है तो क्या हो गया? What does spider mean to you? What is the spider going to do to you? Think you are such big and the spider is so small, he cannot do anything to you. अब ये सब सुनने के सोचने के स्टेट में नहीं है वो पैनिक अटैक में. So when you just handhold them from point A to point B, it works. The same person, after a while, now they get used to handholding. So when they get to work and they're like, okay, how do I deal with this client, or how do I deal with this boss of mine or colleague of mine? That's where they've been told that, look, this is your work, you need to figure out, and whatever the difficulty is, we'll discuss when we discuss in the session. Now I'm not handholding. So what is the state a person is in? A lot of time, I think common sense works, like the wisdom of the old or grandmother's wisdom or whatever we call it. I think having that discretion and whatever I am able to help. If I am a homeopath and if I have some common sense solution, why shouldn't I give? Why shouldn't I give a diet?
But, so sorry, I'm cutting you, but would you tell them, if the symptoms are not going down, would you tell them to consider going to a psychiatrist too? Would that ever come from?
I would. In fact, I have. I mean, there have been people who have been just on therapy, and I felt कि नहीं, you need homeopathy. I have given homeopathy. Some of them get better, some of them don't. And the people who don't, and if we think that things are increasing, then I'm like, I think we need to consider allopathy. We need, for these things which are very strong and that you're not able to manage what we're trying to do, then allopathy is resorted to. I have a friend of mine to whom I refer, and he's an allopathic psychiatrist. I'm like, I'm sending this person. He is open to homeopathy, so he doesn't drug too much. He's like, okay, I'm just giving this much. देख ले तू क्या करता है, नहीं होगा तो बोलना. And we have this kind of a conversation.
I think that makes a good team.
Yeah. So we need a team. That's what I'm saying. We need to integrate. We cannot be exclusive. I cannot say that only homeopathy is the solution for everything, because there isn't. I was telling Aparna about a case. This man came with paranoid schizophrenia on medication. He was okay at that time. So we discussed. I took the entire history and all of it. I found a remedy. We started with homeopathy. We would also talk. He was a lot into spiritualism. So we would have conversations on spiritualism, and he really did well. He did well to the extent where we were able to bring his allopathic medication to 1/10. Okay, and this was again 7 years ago. I was much more enthusiastic at that time. So I was like, "Abhi dawa ban karenge," and only homeopathy can help. See, this is Eureka. I found it. and we reduced the medication. 10th day of stopping that medication, he came back into a full-blown episode of psychosis, ran away from the house that my wife is going to poison me. And I was struggling, how, why? Itna improvement hone ke baad, where we are, he developed a sense of self. He developed that, yes, this is my wife, and the love for her, the love for parents, everything came back. The personality का improve होना हम लोग बोलते हैं, वो भी आ गया था. So I was on cloud 9 कि अभी तो चलो बंद, and you know what, homeopathy can do everything. But he relapsed. We had to go back to again the full dose. Again with homeopathy we brought down things to, and this time much more slower. I thought ki, now very gradually I will push homeopathy more and we will reduce the medication. Second time we reduced. Second time he came back. And I had no clue why. And the family had no clue why. Nothing had happened. And then I realized that, okay, I don't need to be over enthusiastic because it is not about me. It is about the person. The person has to be stable. And if this maintenance dose is helping without interfering, I think it is okay. Rather than me being very ambitious on, I want to treat everything with homeopathy, I think it is the patient's benefit that I need to consider as the first thing. And if a combination works, why not? I mean, what is the problem? Eventually, we want them to help the person, right?
Hello. So my name is Rohit Goyal, and I'm myself a homeopathic student from University of Delhi. So I'll just take a few minutes in motivating all you guys in telling homeopathy what it can do. I'll just throw three practical things. Okay. So first, I would like to give my example. I myself was diagnosed with seborrheic dermatitis 6 years ago, and in all these years, it deteriorated my mental health, my physical health to the extent which you can't imagine. And I have risen from the bottom through homeopathy and Ayurveda, and that's why I'm standing and sitting in front of you all. Second thing I would like to say is that uh, I have been with allopaths and homeopaths both, and I can tell you that homeopaths, if you opt for homeopathy, you get a free mental health consultation along with physical health, because
Absolutely. You're right. Absolutely, you're right.
yes, because homeopaths are very experts in extracting information because there is a very long case history, and with homeopathy, we go for chronic issues. So we have many consultations. So there is a deep connection forms between a patient and a homeopath. Okay. And third thing I would like to tell is there is a concept of constitutional medicine homeopathy. So I would keep it simpler for you. We have we all have different personalities. One is calm, one is angerful, one is very jealous. So with every personality there is a homeopathic remedy. So it's like a puzzle. If you find a correct remedy for yourself, then there is no one in the world who can obstruct your cure. You just have to, a homeopath has to be expert in that field. Homeopath has to be, जिसे हम कहते हैं मंझा हुआ homeopath होना चाहिए. So he has to find your remedy. You have to be patient. And I am myself an example. With 1 year of treatment, I am myself 95% cured, which allopaths didn't go, which Ayurveda didn't go. So that's it. So first,
Thank you. More power to you. Thank you.
And I'd just like to tell everyone that one of the panelists in the afternoon panel, Dr. Pratiksha Sharma, also has a story of being on medicines for 18 long years and then 3 years of homeopathy, and now she's completely off medicines, off all kinds of medicine, even homeopathy medicines, she's off them. So, and again, I think I'd like to sort of, and thank you so much and for saying that, because it just shows such great humility on your part to say that there is no one solution. And it's not about us. It's not about us saying, oh, see, this is correct. It's about helping the other person come to the place that they are supposed to come to for them to lead a better life. And how can you be an agent in that entire thing? So that really is what it is.
You have to play your role.
You play your role, yeah. Okay.
Right.
On that note, thank you so much,
Thank
Dr.
you.
Tiwari, for sharing your thoughts. And oh yeah, so we also have a QR code which is at the registration desk. If you scan that, You will get access to a paper that Dr. Tiwari has written. So, and then you can read it.
Which is on a lot of information about homeopathy that we couldn't cover in this discussion because it's a huge thing. And if there are more queries that come up after reading that, please email me. I'll be happy to answer. Thank you.